afternoon, one and all, respected judges and my dear colleagues. Myself, Dr. Mohammed Shafi. I am working as professor in the Department of Community Medicine at JIIU's Institute of Medical Science and Research, Badnapur, Jalna. The topic of my presentation is professional perspectives among medical postgraduates at JIIU's IIMSR, Jalna. Coming to the introduction, professionalism is a core competency required to practice the art of medicine in the community. Postgraduate medical training environment differs significantly from the undergraduate training, as we know that postgraduates are more exposed to the large number of patients and they have to show their skills or more responsibilities they shoulder in complex situations when they are individually facing the patient and also in the departmental team. The objective of this study was to assess the professionalism among postgraduates. Second objective is to impart the knowledge regarding professionalism to the postgraduates and again assess the professionalism among postgraduates after imparting the knowledge. Material methods. This is an intervention study. The intervention was done in the form of 2 hours interactive session given to all postgraduates regarding the various domains of the professionalism. This was done in postgraduate medical students. That time when I performed the study, 2 batches were there. So total 59 students were included in the study from various PG departments. We have PG in 10 departments. Workplace based assessment tool like mini clinical evaluation exercise was used to assess the professionalism among the postgraduates. The domains which were assessed were clinical excellence, respect to patient's dignity, communication, duty, altruism, honor, integrity, responsibility, and accountability. A close-ended questionnaire consisting of 34 items was developed and its reliability and validity was tested. Then level of professionalism assessed by me by allocating a patient to a PG in the OPD setting, and I will be observing the postgraduate, and the postgraduate was asked to attend the patient. Each item in checklist was assessed on Likert scale of agreement, where it ranges from 1 to 5. 1 is strongly disagree, 2 is disagree, 3 is neither agree or not disagree, 4 is agree, and 5 is strongly agree. Then the mean scores were calculated, standard deviation was calculated, t-test was applied, and ANOVA test was used to see the difference between the different groups of professionalism among the postgraduates. Coming to the results, total 59 postgraduates were included. Out of that, 37% were females and 62% were males. And the mean age of postgraduates was 29.04 years, whereas in the patients, 52% were females and 48% were male. Now coming to the table number 1, which shows the mean scores and standard deviation of the professionalism pre-test and post-test. So mean score in the pre-test was 24.73, whereas it was post-test was 47.64. It has increased significantly and the p-value was highly significant. Whereas when we compare the mean scores in each group of professionalism, we applied the ANOVA test, and here we also found that there was a significant difference because in first 2 domains the scores were high, whereas the other scores were less as compared to these 2 scores. So, but there was a significant difference. Then we again applied ANOVA test for comparing the mean scores in the post-test group. So here you can see that all scores they have improved. That's why there is no significant difference. P-value was 0.99. So all scores improved significantly. Now coming to the distribution of mean scores and standard deviation of patients about professionalism among postgraduates, this was assessed from the patients. This side we assessed the postgraduates, then I interviewed the patients regarding professionalism to the patients. So here also they have given in the pre-test 25.36 mean score and it improved to 54.09 after intervention. So it was significantly higher mean score was found in the postgraduates after intervention. Same in the post-test also we applied the ANOVA test to compare the internal comparison of the various scores in various domains of professionalism. So here again there was a significant difference because all the scores, mean scores were not same for all the domains. Then again in the post-test also we have applied the F-test, and here we find that all the scores they have improved a lot after the intervention, and as all they have improved, the significance was less, and it was not highly significant because all the scores in the post-test group were higher on a higher side. So coming to the conclusion, various methods of teaching and assessment should be considered for various domains of professionalism. This requires a detailed and comprehensive planning at all levels of medical education so that the future young doctors are much better aware of their professional roles. Even short teaching sessions on professionalism can significantly improve the professional behavior and attitudes among the postgraduates. Patient responses or satisfaction scores can serve as an important assessment tool. More data on patients' opinions about doctors may help us in covering all the lacunas in professional attitudes of the postgraduates in today's doctors, and hence we will help reducing doctor-patient conflicts which are presently in rising trend. So my take-home message is, in this era of poor doctor-patient relationship, we should go for, it is highly essential to acknowledge the need to include teaching and assessing professionalism as an integral part of medical curriculum and practically implementing it. So thank you very much.
Thank you, Dr. Mohammed. That research that you have conducted, definitely professionalism is a word, or professional attitude, professionalism is a word very frequently used, but frequently misunderstood as well. So in my opinion, it's a big gray area which is there in front of us. Many a times professionalism is being taken as heartlessness, or where there is no place for the feelings when we say regarding the professionalism. It may have been true for other domains, but as far as the domain of medical science is concerned, there is a lot of value to the emotions, and you have come out with this particular findings only. Sir, regarding the counseling, means you have given a counseling to the postgraduate students.
Yes.
So what exactly you included in that?
Sir, there is one article by Mayo Clinic which says about what are the various domains to be taught to the medical professionals and how to teach them and assess them. So I have used that article, and for 2 hours for various 7 domains, I have given education to them that how they are supposed to behave, like in clinical excellence, means they need to be very clinically expert while giving treatment to the patient, like duty, altruism, honor, integrity, accountability. These are the various domains on which I have highlighted them the knowledge regarding adopting that and then professionally behaving with the patients.
I had one query regarding this altruism. We said that we assessed it in the workplace-based assessment.
Yes.
How we exactly assess the altruism on workplace-based assessment?
Yes, sir. In altruism, in duty also, I consulted the head of the departments of the postgraduates, and there I have taken feedback from them, and then I have given the scores for these domains.
Okay. From the head of the departments,
Yes.
or the unit in charges, and since you consulted the Mayo clinics are also famous for their standardized patient programs.
Yes.
So can standardized patient program in a way be utilized in this?
Yes, sir, we can utilize this. We need to develop it, and then we have to use it. In that scenario, we need to develop our own program. Like in CBAB medical education for postgraduates, they are more focusing on professionalism. So that should be implemented.
Have you come across like where there is the change in the professionalism attitude when the gender of the patient and the doctor, like suppose a male doctor is examining a female patient, is there any change in the professionalism when a male doctor is examining a male doctor, or female as a female doctor? Have you come across something like that?
Not significantly in this in my studies, sir, because I found the behavior of the male PG or female PG was almost same to the same patients, whether it is a male or female patient.
Just I wanted to understand better this table number 4, where what I could gather is table number 4 is about the perception of the patients about
Yes,
the postgraduates.
yes.
Is it, sir?
Yes.
So how we can have pre-test and post-test here?
Yes. Actually, I have assessed the patients. When I assess the postgraduates, I assess them, and after that I interviewed the patient in pre-test group.
Okay.
Then again I gave the intervention. Then I assess the postgraduate, and same patient I assess after the intervention also.
Okay, that is pre-test, post-test.
And post, yes. Both
That
sort
is
of-
from your side.
Yes, sir.
Okay.
You
Yes.
got the same patient in the post-test?
No, it was different patient. That is one of the
That is
limitation
the-
of my study, that different patients were used because it was conducted after some time.
Because the students are the same.
Yes, students are
The
same, but patients are
intervention
different.
is to the student, but the assessment from the patient's feedback is different patients.
Yes,
So
yes.
They will be,
Bias will not be there.
Yeah,
Yes.
subjective. this
Bias
thing.
will not be
And one more thing I want to tell that you have assessed the student.
Yes.
So instead of whatever it is you have studied, it is. But I think you should have involved other teachers also,
Yes,
and the
ma'am.
fixed group
Actually-
of student in the teachers in the pre-test and the post-test.
Yes, yes.
In the, for assessing the improvement, because if this person who is
Assessing.
doing the study
Yes.
may be biased,
Right,
it is
yes.
a subjective
That's
thoughts.
Yes.
Okay, so this is my suggestion.
Actually, ma'am, the 360-degree feedback is the best method to assess the
You
professionalism.
should have assessed the
Yeah,
another
yes,
person
that is
like
true.
nursing staff.
I have planned one more study
Patients'
based on
relatives.
360-degree feedback from nursing staff, patients, relatives, doctors, colleagues,
And the
head of the
teachers
department.
of them.
Yes, faculties and head
And
of
what is the
department.
improvement in the
Yes, yes,
in the
yes.
performance?
That is the ideal way of assessing professionalism.
360 assessment.
Yes, please.